Good morning to all. Today we are going to see about the condition pyloric stenosis. First, I wish to show you what is meant by pylorus. The pylorus is a muscular valve located between the stomach and the small intestine. So, the pylorus is located between the stomach and the in between the gap of small intestine. So, it is the exit point of the stomach and then gateway of the duodenum of the small intestine. So, small intestine duodenum is the starting point of small intestine, and then so here it help the stomach hold the food, liquids, acids and other matter until they're ready to move the small intestine for the digester and then absorb. For the reason they are not entirely understood, the pylorus can sometimes it's become thickened and narrowing, so it is called the pyloric stenosis. Next we are move on the definition of the pyloric stenosis. Pyloric stenosis is defined narrowing of outlet of the stomach so that food cannot pass easily from into the duodenum. Pyloric stenosis result in feeding problem and then projectile vomiting. So causes due to the structural abnormalities of the first babies and then bottle feeding that may cause the pyloric stenosis. And then those who are using the antibiotic, the use of continuous antibiotic life increase the risk of pyloric stenosis in infants. And the next followed by we'll see the pathophysiology of the pyloric stenosis, a diffuse hypertrophy and then hyperplasia of the smooth muscles in pyloric splinter. So here the hypertrophy means increase in the cell size, hyperplasia increase the number of cells. So here the pyloric splinters become either hyperplasia may occur or also hypertrophy may occur. So here narrowing of the pylorus with partial or then almost completed obstruction, stomach content that not flow easily through the constricted pylorus. It followed by it may cause the vigorous or obstruction peristalsis movement which occur. Persistent vomiting and dilated stomach musculature may occur here. Infant develop dehydration and hypokalemic alkalosis may occur. Next we'll see about the clinical feature. So first clinical symptoms, vomiting and after feeding the baby may vomit forcefully, ejected the breast milk and then formula milk, whatever we are giving, the baby is experience the projectile vomiting and the persistent hunger will be there. So after the vomiting the baby is having the hunger and then stomach contraction will be here. And then next dehydration will be there. Babies having the continuous vomiting, it may cause the dehydrations also, and then changes the bowel movement since pyloric stenosis prevent food and reaching the intestine. Babies with the consistent and constipations will be there, and then weight problems will be there. They are poor in weight gain, and then here the weight loss will be occur. Those who are having the pyloric stenosis, we can observe these are the symptoms. And the next we are move on the diagnostic evaluation. Here we have to collect a proper history collection and then physical examination, and then every malnourished infants we have to assess, and then barium meals x-ray we have to do, use the abdomen we have to do, and then blood investigation. In that blood investigation we have to especially monitor about the electrolytes, sodium, potassium level we have to monitor because these children are entered in the metabolic acidosis. So here we have to assess the sodium and potassium ratio also. And the next we are more on the medical management. In that medical management, infantile pyloric stenosis typically managed with the surgery. Few cases mild enough to be treated with the medically. If the children in mild pyloric stenosis means we can treat with the medicines. If they have in the severe pyloric stenosis means we have to move to the surgical management. The only the complication dehydration related problems. So here we have to administer the oral atropines we have to provide, and then high fluid we have to administer fluid through the IV infusion we have to do, and then we have to prepare the mother and baby for the surgery. We have to teach about the anesthesia, how to prepare the baby for the surgery. These are the things we have to do in the pre-operative. Next we move on the surgical management. There is the two main surgical operative procedures are there. First one is the laparoscopic pyloromyotomy, and second one is the Fred Ramstedt pyloromyotomy. These are the two surgical interventions we have to do for the pyloric stenosis. And the nursing management including the we have to pre-operative management, we have to prepare the baby for surgery, we have to keep the babies in NPO, and then observe, record the signs, vital signs we have to detect, and then note the record the amount of characteristics of monitor the stools. What is the characteristics of stool? We have to monitor, we have to stop the fluid, and then there is an olive shaped mass will be there, we have to observe, and these are the things we are observed in the pyloric stenosis. And then give small frequent feeds. We have to provide weight of the infant. We have to daily monitor, maintain the strict intake and outputs that we have to monitor, provide warmth the infant and protect the infection. Prior surgery has to lavage. We have to provide fluid and electrolytes monitor. We have to monitor for the 14 to 48 hours. We have to monitor after the surgery. These are the post-operative management we have to provide for the baby. And then next we are move on the post-operative care. First, observe for the signs and symptoms of complication, management of pain. If the after the surgery, the babies may experience the pain. We have to provide the pain analgesic medication. We have to provide it here, and then we have to maintain the adequate food and nutrition. Parental education is must be here. Follow what is the follow-up care. What are the food we have to provide for the baby? These are the things we have to include in the post-operative care. And the next one is the complication. Here, the wound infections may occur, incisional hernia may occur, persistent vomiting, stagnation of gastritis, and then shock will be occur. Thank you. These are about the pyloric stenosis.